Hi everyone and welcome back to my channel. My name is Sophie and this channel is chronicling my journey of living my best life with multiple chronic health conditions. Today I'm just going to do what hopefully will be a quick medical update with all of the doctor appointments I've had in the recent past. Starting with back in July, before I went to Cleveland Clinic, I had what it turned out to be oral fibroma removed from my gum. It basically feels like a skin tag. They removed it, and literally the next day it was back. I did call them, and I'm like, yo, it came back. And they set up an appointment for when I got back from Cleveland. And the doctor, at this point, the results were back, and that it was benign and a fibroma, which is what I thought it was. He said he's not worried about it and to let them know if it gets bigger or if it bothers me or whatever. Otherwise, I could come back in a year and they can look at it again. So it's, like I said, it's back. So I guess it's just gonna hang out. It doesn't bother me. I can just feel it if I move my tongue all the way back there in the corner, which I don't do on a regular basis because it's way back in the back of my mouth. But yeah, so I thought that was interesting. I actually had pictures of it the day after when it had grown back, and even though I had pictures and the doctor could see it, he still denied that it was possible for it to grow back as fast as it did. I don't know these doctors. I just don't know what to do about them. Let's see. Interventional pulmonologist at Cleveland Clinic. I met with him shortly in the beginning of August. Obviously nothing happened. He was interested in genetics and their note wasn't available. And as of yet, the tests they did were normal, as I've said. They're trying to get my insurance to approve of the whole exome sequencing. Currently, my insurance has denied it for saying it's not medically necessary. The geneticist is apparently going to do a peer-to-peer talk with one of the doctors at the insurance company to try to convince them to pay for it. I'm not getting my hopes up, and even if they do it, I'm not convinced they'll find anything because they don't know what they're looking for. I even asked them, do my symptoms point towards anything? And their answer was basically not really. It's not really specific, but it could definitely be genetic. Or a rare presentation of a rare condition type of thing. And I'm not sure how whole exome sequencing is going to help since they don't have any idea what they're looking for. It's sort of like looking in a haystack for a needle, but not even knowing if there's a needle in the haystack. But I guess we'll see what happens with the peer-to-peer consultation or whatever you want to call it. I'm not really willing to pay out of pocket for testing since I had whole genome testing done that they don't want to look at. But if it's going to be covered, then, that's fine. Let's see here. The cardiology and nurse practitioner I saw, and we did increase my Farxiga. That's been a couple weeks now, I guess. I didn't really notice any difference. My weight was stable, and it actually occurred to me that maybe my weight was part of the reason I was fatigued because I was holding a lower weight by 5 pounds for a few months. And once they started giving me the Farxiga and the spironolactone, I was getting really lightheaded, so I let my weight be higher by about 5 pounds. So kind of by accident yesterday, work was crazy, so I was unable to really eat or drink much. The drinking much was totally on me. I probably could have taken more sips of water while I was orienting, but I did not. And I am 2.5 pounds lighter this morning than I was yesterday. So it'll be interesting to see what my fatigue is like today. And sticking with the cardiologist. I have not heard back from the cardiologist about what her colleagues think. She did say it might take a few weeks, so I guess we'll just see. I have no plans on messaging her and being like, did you hear anything? I am not chasing after doctors. In a similar fashion, I messaged the cardiac nurse practitioner the lab results because the thought was if my labs were okay and I was still holding fluid, that we would increase the spironolactone. I messaged her almost a week ago. I've not heard back. And then I messaged her again yesterday, giving her the update because I saw nephrology, which basically was a nothing appointment. He doesn't really understand autosomal dominant Alport syndrome. He was under the impression it was like more aggressive than it is, and that if I really had it, I would have kidney failure by now, which just isn't the case. It's actually normally a more mild form of the condition. But he said, like, regardless, like, you're on Farxiga, so we're just gonna, like, see you back in a year after we, like, do blood and urine tests and, like, see where things are. Which I'm totally fine with. I'm not married to the diagnosis. And then I was asking him if he thought my kidneys had anything to do with my inability to really handle carbs or sodium, and he said no. When I was showing him images of my edema at the worst, he was like, we don't even really, like, that would be like end-stage renal function, and you're like nowhere near there, so that's not the kidneys, that's something else. So that was a bummer. That's more what I wanted out of it. I wanted to be able to figure out what I can do to not have to be so strict with my diet, but that didn't happen. I see rheumatology next week. She never does anything. I'm basically going to tell her, like, I'll make the next appointment, but when I get labs done, if they're stable, I'm just going to cancel it and reschedule it because I don't see a purpose in taking time out of my day and work schedule to go to an appointment and to be told I'm fine. There's just no need for that. If that's all it's going to be, I'll just wait until my labs are abnormal, which they're normally not for her, so that's really it. Longer than I was expecting it to be, and I apologize for that. And I'm probably not looking at the right place because my laptop isn't really working, so my laptop screen is off, and I'm just using the camera, but my monitor I'm using is higher, so that's like I'm looking at my monitor now, and I think I'm looking into the camera now. I have no idea, guys. I don't know what I'm going to do about that because I cannot afford another laptop right now. So I guess we'll see how bad and awkward this video looks and go from there. But that is going to be it for this video. I hope you guys are having a good day whenever it is you are seeing this, and I will talk to you guys next time. Bye, guys.